On the front lines right now of the coronavirus fight are starting to suffer from moral distress. The conditions required to treat patients are less than ideal, and some doctors are wondering if they're doing enough during the crisis or they have tough decisions to make. And joining me right now is Regan Streiff Institute research scientist and practicing physician, Dr. Alexia Torkey, to talk more about this. First of all, good morning to you and thank you for all that you do.
Good morning. Thank you for having me.
Absolutely. Let's talk about this in depth a little bit here. This moral distress, and how do you describe that?
Moral distress is the experience when a clinician, such as a physician or nurse, feels that they know the right thing to do, but something or someone prevents them from doing it. It's something that physicians and other clinicians experience in their practice all the time. But there have been so many changes in the way we need to practice medicine during the coronavirus pandemic that I think it's even heightened.
Yeah, let's talk about some of those specifics and what you're seeing and how COVID-19 is really contributing to even more of this moral distress.
Yeah, I think one major change that we've all experienced in the hospital setting is that people can no longer have visitors. And so patients are often isolated. They come into the emergency room and then are admitted and can't have their family members by their side. And I think clinicians are really feeling the stress of how lonely our patients are and how separated they are from families. And that's even more difficult when patients lose consciousness and lose the capacity to make their own medical decisions. Then we're asking family to make decisions for patients when they can't even come visit them or see them or learn about what's happening in the hospital by being at the bedside day to day like they usually would. And it's just causing a tremendous amount of stress.
Especially when, too, like you said, they've lost consciousness or then someone passes away in the middle of that. And I'm guessing that, you think of things like post-traumatic stress disorder and some of these after effects that these doctors and nurses might be facing, that is a real possibility for them.
Absolutely. Moral distress can have significant impact on clinicians, including burnout, difficulty working as effectively in the clinical setting, likelihood to leave a job. And so it has serious effects on our clinicians.
Let's talk about, we always try to look at both sides of everything, at least I do, and trying to think of, is there a positive, though, that can come out of this? And are there things that bring hope or something good that comes out of a doctor or nurse caring for a COVID-19 patient? What are your thoughts on that?
Absolutely. I mean, I think that in my time in the hospital during this crisis, I have never seen a more profound sense of duty and calling among our clinicians. Doctors, nurses, pharmacists, everybody has just really been pitching in and doing everything they can to help. And of course, taking risks by being on the front lines of this pandemic. And I think that I see many clinicians taking pride in their role in what they're doing for patients and also in innovating to find new ways to help patients with this challenge. Like, for example, setting up video calls between patients and their families, between physicians and families when they have to make hard decisions, just being really creative in ways to connect people in the ways that are so important. And so, yes, although there have been some real challenges for clinicians, I think there have also been some inspiring moments.
Dr. Torkey, thank you so much. So many heroes for what you and what so many are doing. So again, thank you for joining us and thank you for what you do.
Thank you for having me.
Absolutely. Okay, it's 8.